So hello guys, I'm Dr. Ismail from Veterinary Clinic, Saudi Arabia. So today we have this 2-year-old cat which presented with very non-specific symptoms a few days ago, checked by another vet, and today it presented to our clinic. So when we examined the cat, we felt that she has a little bit fluid developing in her abdomen, and she has a little bit of breathing difficulty as well. She's not eating, not playing, just laying down on the floor from last 2 days. So the owner brought the cat today and we checked. So we suspected this cat has FIP based on clinical presentation. So we saw the cat has fever as well. It's 39.6 right now, and labored breathing. And if we see the legs, it's all developing fluid inside, so all edematous, all 4 legs. And when we heard with the stethoscope, her chest has very wheezy sounds inside, and there is very pulmy fluid sounds in the abdomen as well. So we ran blood test and X-rays to confirm whether it's FIP or something else. So let's go. We'll see the blood test and X-rays and we'll discuss further. Thank you. So this is the X-ray of this cat. So if we see the chest, let's see the chest first. So in this area you can see this is hyperinflated lungs, and the gas is actually not going and passing through it properly, and all this cranial chest, the cranial mediastinum, it's all really filled with fluid inside, and you cannot see the boundary of the heart as well, and there is all free fluid developing in the chest. So if you go a little bit back to the abdomen, you can see you cannot really see any of these structures properly because of the fluid buildup in the abdomen as well. It's not too much fluid right now. It's a sign of peritonitis, so it's developing slowly, but physical exam you can literally feel there is fluid developing in the abdomen. So if you see here, you cannot see any of the organ properly. And if you see the kidneys, this is one kidney here, this is the second kidney. It's actually being pushed up on the up to the vertebrae because of the fluid, and all this fluid, the grayish fluid in the abdomen, is also another indication of wet FIP. So let's see the other views as well. This is the another view. If you see the chest, same fluid developing in the, this is the abdominal X-ray, similar again, all the fluid building up in the abdomen, and this is the VD view. So if you see the VD view, you will see the all the cranial mediastinum, it's all filled with fluid, and the lungs, they are not really in good shape. It's hyperinflated lungs, and all the abdomen, you cannot actually see any of the organ properly. So this is all actually fluid buildup in the abdomen. It's not too much fluid right now, but it's developing, but it's a sign of peritonitis when you lose the details of the abdominal cavity. So this is another indication of the FIP in cats. And this is the blood report of this cat. So if you can see the red blood cells here, it's 3.79. Normal should be 4.6 to 10. So it's getting anemic, okay, which is another sign of FIP. So they start having anemia, and sometimes other changes in the hematology. And this is the major section which you need to look out whenever you are suspecting a cat for FIP. So this is 24 panel chemistry. So as you know, the major concern whenever you are seeing a patient of FIP is AG ratio. So if you see here, the AG ratio is 0.38, okay, and whenever you see AG ratio below 0.5, you always have to look out up as well. If it's only the globulins which are higher because of chronic inflammation, which can be due to any reason, or it's really something causing albumin to go down and globulins to go higher in chronic inflammation. So if you see here, this cat has a very low protein level, 10.7. Okay, and the globulins, they are still not very high, but still the AG ratio is 0.38. so that's a very typical presentation of FIP when the level of the albumin starts going down. Okay, and the level of globulins, they start going up. So otherwise, if you see, there is so many other changes as well, but nothing is more specific for FIP. This is a general change. For example, if you see here, CK is more than 4000, normal should be 02559. So it's a muscle enzyme which give you an indication of muscle injury in your body, any type of cells. And if you see, blood urine nitrogen is a little higher, and calcium is low. So these are non-specific changes, but the major concern of in these FIP cases is your AG ratio, which is 0.38 right now. So this is another indicator of FIP. So that's how you diagnose FIP. You actually see all these signs, symptoms, history, and X-ray, blood test, and collectively you make a decision that either it's FIP or no. So this is a very typical case of FIP. Age, symptoms, chronic disease, fluid development, and along with the albumin to globulin ratio is low. There is a lot of other things which you can do is PCR for confirming the FIP virus, which is not normally available. Still same, you can do a Revolta test if you have at the clinic, but this is enough investigation to reach a conclusion that this is a FIP case. So we'll see you inshallah next time with another case. Thank you so much. If you have any question, you can ask in the comment section, and we'll see you inshallah next time. Have a good day.